Hello, everyone. I'm Sean O'Neill. I am the Compliance and Chief Privacy Officer for Vault Workforce Screening, a Sterling company. Vault is a trusted workforce screening partner, supporting clients ranging from government agencies to Fortune 500 companies in the design and management of their employment screening programs for the last 34 years. We are excited to have you all here today for our first webinar of 2024, which is titled Safety First, Understanding MRO Safety Letters and Add-on Requests in Drug Testing, which is going to be presented by our Chief MRO for Workplace Drug Testing, Dr. Suzanne Steele. Dr. Steele is Vault's Chief Medical Review Officer on our workplace drug testing side. She is a family medicine physician with 30 years experience, which includes employee and occupational health medicine. She has been a certified MRO for 20 years. She's a graduate of Hahnemann University College of Medicine, the current Drexel University College of Medicine, and she received her Bachelor of Arts degree from the University of Pennsylvania. Before we begin, we want to remind you the information and opinions that we are expressing today are for educational purposes only. They're based on current practice, industry-related knowledge, and business expertise. The information you walk away with today should not be construed as legal advice, express or implied. We always recommend before you make any changes to your screening program, consult with your legal counsel before you take action or choose not to take action based on any information you walk away with today. All right, let's talk about what we're going to cover today with Dr. Steele. We're going to cover two areas. We're first going to talk about safety concern notices. This is something that is common in both regulated drug testing as well as non-regulated drug testing for workplace purposes. This isn't something that comes up in recovery management or professional health monitoring. This is an employment drug test related item. And then we're also going to cover additional testing that medical review officers might request during their review of a result before they can release that final result to the employer. And as I said, we'll also have time for a Q&A, and we'll also ask that you fill out a survey following the call to make sure that we are delivering information that meets your needs. And with that, I am very excited to turn it over to Dr. Steele, who's going to walk us through these two important topics. Take it away.
Hi, everyone. Very excited that you're here today. Welcome. And we're going to talk about one of my favorite topics today, safety concern notifications. I do get calls here and there from designated employee representatives saying, hey, I got a safety letter. We thought we would talk to you about safety letters today. Again, welcome. First thing that we're going to go over is safety sensitive positions so we can understand what type of positions might receive this safety concern notification. There are a few DOT regulations that for DOT cases help us with guidance on how we should handle safety concern notifications, and that's where the 5-day pause comes in, and we'll go over that. However, for non-DOT testing, there can also be safety concern notifications sent, and we'll be targeting some of those issues. We're going to talk about what is a Miranda warning, why we give it, and when. We're going to talk about reasons why we might issue a safety concern notification. We'll talk about who gets these safety concern notifications, and we'll talk about what you can do if you receive one of those from us. First thing I'd like to hit upon is safety sensitive positions. A lot of times when we get DOT testing, the form lets us know that this is most likely a safety concern type of position, that something they do is involve safety. But that might not be completely obvious in the non-DOT testing. It's always good to keep in mind that we can help you if you want to know if one of your positions is safety sensitive. You can talk to us about that. But it's good to know that safety sensitive positions means the position is safety sensitive while the person is performing it, right before they're performing it, there's a safety issue to consider, and that they are available to perform that. So that might be completely obvious with an airline crew that they might be on standby to replace another crew, and you want them to be as safe as they possibly can, but that might not be completely obvious for somebody who typically has a sit-down job. Let's say it's a nursing supervisor. She normally has a sit-down job, or he normally has a sit-down job, but suddenly some of their workers don't come in, and they now go and fill in a role that they don't normally fill in, and they go back to doing regular nursing and not being the supervisor, then they're performing a safety sensitive position. A lot of times we get people who say, oh, I'm just a supervisor. I don't drive the box truck. I don't drive a commercial vehicle. But they know that in case of emergency, somebody not showing up from work, they might have to fill in that position. Same thing with a substitute teacher. They might not be on duty the next day, and then all of a sudden they get a call the next morning right before it's time to come in and say, hey, we need you. Please come in today. While it is the employers who determine who gets a safety letter, again, we can help you. If you're not sure, we'll go over things that in that particular position might make that a safety sensitive position. For instance, a position is safety sensitive if the employee themselves can be in danger, if employees around them could be in danger, or the public that they're interacting with could be in danger. And it could be potential harms to the environment, such as the air, water, soil, flora, and fauna. So you might be thinking that a job is not safety sensitive, but they could mix some chemicals together and that could initiate a noxious gas, and you could have some of your employees passing out when that person didn't, chemicals don't mix together. An obvious one is when there's a tanker in an accident and they spill noxious chemicals onto the highway. Another risk would be if something that they do could cause harm to property or public safety. One obvious one might be, again, if somebody crashes into something. There was a bridge that went down in Pennsylvania recently, so that was harm to the public as well as structure. Luckily, infrastructure was repaired pretty quickly on I-95. Another role that involves safety is if somebody is going to be carrying a firearm. That might be pretty obvious, and sometimes we have correctional officers, and we have to remember that they might be carrying some sort of firearm or weapon that could go off. Maybe it's a taser. We have to think about our emergency response personnel, people who are riding on ambulances, and also anybody that has to have critical decision making that would impact life or limb or health. We have to think about our x-ray tech who might be using injectable dye that could cause somebody to go into anaphylactic shock and not be breathing. We have to think of our nurses who are giving out medications. We need to make sure they give the right medication in the right timing and the right dose. There's many types of critical decision making that could come into play. Think of your construction workers. They might be, in your mind, performing just simple laboring, but if they're laboring near a gas pipe and that gas pipe then could cause an explosion, we need them to have their critical decision making hat on that day, not just their hard hat. When we get the donors to interview them, we're looking at what kind of case is this, and sometimes it's a DOT case and they have a transportation job, and we know that they've gotten the medical exam where they've reported medical conditions and they've reported out, hopefully, all the medicines that they will be taking while they'll be working. But a lot of times we interview donors who are non-DOT, and we have to ask them, what is your job title? Because that's not on the chain of custody and that's not on the lab report. And then sometimes we don't know what that job title is. We've never heard of that before. So we're going to ask them additional questions to find out, is this a safety sensitive job? Are you operating heavy machinery, a forklift? Do you go up on a ladder? Are you around dangerous chemicals? Do you have somebody's life in your hands? Are you the respiratory therapist who's in charge of a ventilator, which is in charge of a patient's breathing? Are you the surgical tech who is responsible for sterility in the operating room? Nobody wants to have a surgery, everything goes great, and then they get sick from an infection and possibly die of an infection after the surgery went well. There's many types of job titles that are tested on a non-DOT form, and we have to elicit while we're speaking to the donor what might be safety sensitive about their job, so that when we're looking at any medicines they might be taking or any medical conditions that they reveal, and making a decision whether we think that there might be a safety issue potentially for them in the workplace. There are two federal regulations I'm going to touch upon here, and although this is for DOT testing, please keep in mind that some states mimic DOT, and some of our clients have asked us to use the same standards that DOT does. So that's why I bring up these federal regulations for everybody. And as the MRO, we are tasked with, when we find out certain information, giving some of that information to a third party if, in our reasonable medical judgment, we determine that we think there's a potential risk to safety in the workplace. We can't do that on a chain of custody form. That's why we have a separate form called the safety concern notification, and it's the same form letter all the time. And we also often send that out with an email letting you know that we've sent you a safety concern notification with the result, so you know to look for both the negative result and the safety letter. At the beginning of the conversation that we have with the donor, we're responsible for giving them a Miranda or a warning. Nope, we're not the police. This may be against you in a court of law. It's not that kind of Miranda. This kind of Miranda is just letting them know that information that we might receive during the interview could be used to make a determination of whether we think there's a safety concern. And if we think there's a safety concern, we're responsible for telling certain entities, and usually that entity is the employer or another physician in the case of drug testing. In the case of DOT, we do offer a pause for the prescribing physician to contact us, and we're going to go over that in a little bit more detail. That's different for DOT than it is for non-DOT. For non-DOT, there is no 5-day pause. For DOT, there is. What types of things might we send you a safety concern notification about? We might send you a safety concern notification because of medications that are concerning. We might send you a safety concern notification about medical conditions, or we have a result that has opiates and we're not sure of what the source of the opiates are, and that would be a safety concern, and that's the third category that we send safety concern notifications about. When we share this information with the employer, we're limiting what we disclose so that we're maintaining as much of the employee's privacy as possible. We're sharing just the medical details that go along with what safety-sensitive duty the person conducts and how that medication or medical condition could affect them. And we base this on what the donor has told us that they do, or if it's a DOT, Department of Transportation, we have a good idea already of what they do. Again, we're informing the donor at the beginning of the conversation before we receive any medically related information that we might have to disclose information if a DOT regulation permits or requires it, or if in our reasonable medical judgment, the information that we get could mean that the person potentially has a risk to themselves or in the workplace. When we send these letters out, it says on the letter a little bit about what your next steps could be. And often this is recommending that a donor is evaluated either an occupational physician or their own physician for any kind of safety issue that we've uncovered, or we might be letting you know that we're available to speak to a physician that's either going to examine them or that we could speak to their physician who's treating them. A little bit more about the 5-day pause. Please understand that this only applies to prescription medications. It does not apply to medical conditions. When we have a bona fide prescription that we're able to verify, then we're going to wait 5 business days for the prescribing physician to call us if the donor has decided that, yes, they would like their doctor to speak to us about our safety concern. And in that conversation, that doctor, we tell them what is our safety concern, and sometimes they tell us about their safety concerns that we didn't even pick up. More often than not, however, if the donors choose not to have their physician call us, which is okay, they are allowed to decline or opt out. If they opt out, then we're not going to wait 5 days. If their doctor calls us before the 5 days is up, then we're going to inform you if we still have the safety concern, if the safety concern can't be resolved, or if the safety concern is resolved and there is no concern, then we're not going to send out the letter. However, once we've sent out the letter, if the physician calls us after that, we'll still speak to them. If the safety concern can be resolved, we will let you know that's separate from the safety concern letter that we've sent out. If we find a medical condition, the 5-day pause does not apply to medical conditions. You will get the safety letter at the same time as you will get the negative result. There is no 5-day wait for medical conditions. Somebody reports they've got seizures, especially new onset seizures, or they're sleepy while they're working, or they're being treated for sleep apnea, but they're not compliant with their CPAP machine, or they just had a heart attack, or they just had a stroke, then these people are more likely to have another heart attack or stroke in the near immediate future. These are medical conditions that we're going to be concerned about, and we're going to let you know there's a potential risk for this particular person's workplace. Again, we don't wait 5 days, but that goes out on the same day as the negative result. What is the science behind us considering to send a safety concern notification? And a lot of medications have effects and have side effects that can be concerning in a safety sensitive position. A couple of the ones here that I pulled out are the opioids and opiates. They have been linked to an increased risk of errors in the workplace, and if you're a commercial driver, that is an increased likelihood of having an accident. For instance, when they compared Tylenol plain to Tylenol with hydrocodone, the pain relief was the same. However, the crash risk was higher in the people that were taking hydrocodone. Same thing was found with the antidepressants. One type of antidepressants that a lot of people are familiar with are benzodiazepines, such as Valium, Xanax, Restoril, different medicines that people are using for muscle relaxation, anxiety, and helping them with sleep. So if they're using these medications, those medications stay in their system for a very long time. They might not think that's affecting them. However, it is affecting them, and they're more likely to be having errors in the workplace, including crashes, if they're a driver. Stimulants can work in one of 3 ways. One is if they're taking the stimulants appropriately for appropriately diagnosed condition, they need that stimulant most likely to be focused or be attentive or be awake and be responsive. However, when they don't get their medicine or they don't take it as prescribed, they're not going to be focused, they're not going to be attentive, and sometimes when they take too much of their stimulant or they try to abuse the medication or they're taking it for reasons other than the body that their body requires that medication, they're likely to be agitated, overstimulated, and think of colleagues not getting along with each other in the workplace, or a driver having road rage. We don't want our employees to be agitated when they're on the job. If we uncover during a interview that the person has a history of abuse, maybe they've revealed that they're on particular medication because they had been abusing a different medication, or they might reveal other instances of a history of being dependent or abusing medications, that's a potential risk for that to occur again, and that might make us more likely to be considering a safety concern notification under those circumstances. A lot of times our donors will underreport what they're using, what they're taking, what medications they have, and we'll do the same thing with their alcohol consumption. However, if they decide to be braggadocious that day and they say, oh, you only found my codeine, you didn't find my marijuana, or they say, why are you so concerned about my hydrocodone when I had 5 beers? If they happen to give us a concern, we're going to want to transmit such concerns to the employer that there might be a potential for a safety issue in the workplace. And again, we're going to base most of that on what is the job title that they hold and what are their duties in that role. Safety concern notifications are not mandatory. They're not mandatory in DOT testing. They're not mandatory in non-DOT testing. It is something that's at the discretion of the medical review officer, and that's why we have physicians doing this, because we know about medical conditions and we know about the pharmacology of medicines, and we put those things together with understanding what somebody does in the workplace and how their physiology and their body functions, and we make a determination of, could this slow somebody down? Could it make them not be focused? Could it make them be agitated? Could it make their reflexes be slowed down and they won't respond? Could it affect their critical reasoning? Maybe they won't make a good decision. Maybe they will not be paying attention and choose the wrong medication to give somebody. These are all things that are going through our heads and churning when we're trying to determine whether we think there's a safety concern and deciding whether we need to let you know that. We're not sending these out to inconvenience anybody, and we don't want to prevent anybody from getting a job. We want to increase their safety in the workplace. Nothing is perfect, or nobody's going to be perfect, but if they're doing something that's significantly harmful and there's a better option, then we can maybe have them pursue a better option and be safer in the workplace. This is why we're doing this. We're not doing it to generate extra paperwork for anybody. We're just trying to have the workplace be safer for everybody. And we also are not judging somebody. We're just judging whether there's safety or not. Again, there are different entities that are typically informed about safety. The top two that we're discussing today are the employer and a physician that would be assessing for safety. Sometimes when somebody has failed a drug test and they end up in a return to work program, then we might be discussing that information with a substance abuse professional who's trying to get them back to work. In the case of smaller owner-operated vehicle companies or any kind of small commercial or TPA companies, we might be talking to somebody at that employer who's not necessarily the designated employee representative. It might be a requirement also that we're required to report certain things. For Federal Motor Carrier Safety Agency, we're required to report certain things as per federal regulations. And after there's an accident, when there's an investigation, sometimes we're responsible for reporting certain things to the NTSB. We're not going to report every concern. If we reported every concern, you would be overwhelmed. We would be overwhelmed, and the employees would be very concerned about why we were sending safety letters. We're trying to limit it to where we really think there might be a potential for a safety risk. Let's take, for instance, pilots. Why would we be sending a safety concern notification on a pilot? Pilots may reveal things in their interview where that medication might be something that's approved for them, which is very rare since they have a very long list of things they can't have, or they might reveal an over-the-counter that would affect them in the workplace, especially at higher altitudes with a different effect would on the ground. For instance, pilots can't even have Benadryl, which every other worker might be able to tolerate. Pilots are not allowed to have that if they're going to be flying. Let's take nurses, for instance. Nurses, we want them to be able to respond quickly to emergencies. There might be a patient that's suddenly not doing well. We need them to have their critical thinking caps on, make decisions in quick instances. If they're running a code, they have to choose the right medicine to hand off to the next person, or that person asks them for one medicine, adenosine. We don't want them to hand atropine. Those things sound alike. We need them really paying attention to make sure the right medicine is given in the right dose in the right manner. We talked about teachers before. Teachers have a role in emergency situations. Let's say there's a fire in the building. Let's say there's an active shooter in the building. Suddenly they are the first person to respond in those kind of events, and they have to protect the students that they're in charge of. Suddenly their job becomes safety sensitive. The same thing goes for construction workers. I've mentioned it before that they might be around hazards. They might be around electrical hazards where somebody could get electrocuted. They might be around chemicals. They might be around gas that can explode. There's all kinds of roles where persons might be a safety concern, and we need them to be paying attention, and we will report if we have a concern. Now you've received a safety concern notification from us. You know better than we do what this person does, and you might know some of their medications they're on if they've reported that, for instance, on a pre-employment physical, or if it's a driver, if they've reported that on their physical to attain their CDL, their commercial driver's license. Now you have this safety concern notification from us, and you're thinking to yourself, okay, what do I do with this? If it's a prescription medicine, Is it a prescription medicine that they've already been on and it was already approved by the medical examiner and we're just not aware of it? Or is this a new medication and they didn't, or is this a medication that they shouldn't be on in the workplace? Is this something where they can go back to their doctor and get on something that's safer that provides the same remedy? Let's say you take somebody who is seeing pain management, and pain management sees them for all of 7 minutes. The person comes in and says, I have pain. The pain management doctor fixes the pain. But they didn't know that the person had a safety sensitive job. They didn't give the person a note to be out of work if they take that particular medicine that's going to make them sleepy, sedated, poor decision making, dizzy. They're thinking success, I fixed their pain. They're not thinking about how that might affect them in the workplace in the short amount of time that they have with the patient. You might opt to send that person to one of your physicians. If you have an employee health physician or an occupational medicine facility near you, you might choose to have that person seen and evaluated, where they can actually take a look at the person, see if their blood pressure is okay, see if their heart rate's okay, check for any signs of illicit substance use, do a full history and determine all the medicines and all the medical conditions that the person has. These are things that are outside the scope of a drug test, so we can't determine that just from a drug test and an interview alone. You might send them back to the physician that treated them, and you might send them back with a note that says this is what they do for a living. Are they safe to do this with the current regimen that they're on? And then wait for a letter to come back from that physician stating, yes, I believe they're safe, or no, I didn't, and I changed it to something safer. Other considerations are you might decide that you're not going to have them perform a particular duty because they have to stay on that medication or that medical condition is not going away. And you might decide that you're going to, similarly to when somebody gets injured, put them on light duty. Unfortunately, sometimes the medical condition or the medicines have to stay and they're not compatible with the job title that the person has, and they might be given a totally different job title, or unfortunately they might not get to continue in that job. And we are aware of that and we do take that seriously. We're not trying to have anybody be out of work. So I brought together a few scenarios, a couple that I made slides for that I'd like to bring to your attention. And what I want you thinking about while you're hearing these descriptions is thinking about your workers in your particular job location and what type of things they do that are safety sensitive and how us finding out about them might impact their ability to be safe in the workplace. These are real cases that I had recently, and I changed the names, the gender, the employer, etc., so that you wouldn't know who these persons, who these owners. So this was a young person in their early 20s who was doing licensing. This person was discovered to be taking Adderall at a relatively high dose. And keep in mind, when we get the lab reports, we are taking a peek at what the levels are, because there's a range of normal levels for stimulants, and there's a range of, gee, that's really out of what the ordinary levels would be. We do see those on the lab reports sometimes. Not all labs tell us that. Depending on how you ordered your labs, we get a level, or we may just get it's higher than 3,000 or it's higher than 10,000. Those are not as helpful as when the lab tells us this person's at 80,000. So typically we're going to see levels below 10,000, below 20,000. But if we see a level that's 40, 50, 80,000, we're going to have a concern. This particular individual was very young, meaning they started on their Adderall relatively recently. It hasn't been decades and decades. And they're already on typically a top dose for Adderall. And studies have shown that taking Adderall higher than 40 milligrams usually doesn't increase the benefit. It just increases might have. And we talked about agitation. This person mentioned that he sometimes takes his medicine if he feels he has to focus at work and school. He's thinking about taking it at work, but he did take it when he was at school and he had exams. He's not consistently taking the medicine. He's not exactly taking it as written on the bottle label or maybe as intended by the person who prescribed it. When we asked about any side effects he might be having, since he's taking this relatively high dose, and we asked, are you experiencing any insomnia, muscle spasm, feeling anxious, or having difficulty sleeping? He admits that he is taking, and I'm only saying he because it's he in the picture. I don't remember if it was he or she. He's taking trazodone, which is originally a medicine that was created for blood pressure, didn't work very well as a blood pressure medicine. Turned out it had sedation as a side effect, and it is used somewhat safely for sleep. But it can cause arrhythmias. It can cause the heart rate to be uneven. In addition, when we asked about whether there was any elevated blood pressure or feeling anxious, propranolol is another medicine that's used for blood pressure, and it can sometimes be used for people who are feeling anxious. That was on board, and an anti-anxiety medicine, bupropion, which is used for generalized anxiety disorder and depression. Here we have medicines that are stimulating, and that is concerning when you see what we on the streets would call uppers and downers, but when they're prescribed and it's under supervision, you wonder, why are they getting both of these? How come either one dose wasn't lowered? How come more medicines were added on and then more medicines were added on? In addition, 2 of these medicines can lower blood pressure. We don't want anybody who's in this kind of role to pass out. They're in the hot sun perhaps, and they have other things that could be affecting them. Having a low blood pressure would not be a great idea. And 3 of their medicines are sedating. If you're a lifeguard and you need to respond quickly and you need to have quick reflexes, the last thing we want is you to be snoozing on the job, not watching that somebody's not moving. It's much harder when you're a lifeguard to see that somebody is not moving than to see that somebody is moving. When we asked the person if they who was prescribing the medicine, it was being prescribed by a nurse practitioner. We asked if they knew if the medication regimen was being supervised by a physician. They didn't know any supervising physician being involved. They had never seen a physician. The experts typically in this particular line of medication are the physicians, psychiatrists, family medicine doctors, internal medicine doctors, pediatricians, people who give these medicines all the time. And a lot of times when physician extenders are seeing the person, it's not unusual for them to have to see the doctor at least once a year to make sure that the regimen is appropriate and that they're stable in their medications before the medications are continued. When we called the pharmacy to verify the 40 milligrams per day, it turned out that the bottle was 20 milligrams per day, that the person had been taking a lower dose during the summer when they weren't in school, but that was when they were performing their lifeguarding duties. It was unclear what dose really works for them and what dose that they should be on. We had a lot of different safety concerns in this one case, many medicines on board causing many potential side effects, possibly not being focused at the job for many reasons, not taking the stimulant, and having several depressants on board, and things that could make this person more likely to not function in the workplace. Another scenario that we have is persons who have to have long haul drivers and people who work long shifts. Let's say you're a nurse who's working a 14-hour shift. That's not the typical workday for most people. Most people, by 8 hours, they've had enough. It's time to go home. They've had an hour break. They've had 2 15-minute breaks. And by 8 hours, their body is already telling them, hey, I want to go to sleep. But for people who have to drive for very long amounts of time or work a very long shift, they might be using stimulants in the workplace, and sometimes they might be overusing them, using them inappropriately, and not using them as prescribed. In one case, we picked up an individual who was prescribed 20 milligrams of Adderall twice a day to be taken in the workplace, and the workplace was nursing. But what is a day for that person? That person didn't have a discussion with the prescribing person to say, hey, I work really long shifts. This medicine isn't lasting long enough. Hope you don't mind, but I'm taking a 3rd and a 4th dose while I'm on my shift. They never had that discussion with the prescriber, so the prescriber didn't tell them that's dangerous. The prescriber only prescribed it to be taken twice a day. But the person decided, if I don't take it on my days off, I don't take it when I'm sleeping, I'll have extra, and I can take 2 extra doses while I'm working. When we uncovered that, it was because that person had a level of 81,000, which that could signify that they're taking too much medicine, and in some cases, not this one, that they're actually addicted to the medicine and taking higher doses to try and get a certain effect. In this case, when it was brought to the donor's attention, that's not what's on the bottle label. That's a lot of medicine, and your levels are very high. Are you experiencing any side effects? The person said, maybe that's why I was in the emergency room last Friday night with chest pain. And that was while they were on shift, that they had to leave shift and go to their own ER for chest pain. And I said, it could be, because if your blood pressure gets too elevated, that could cause you to have heart troubles. And she said, but they knew that I was on this medicine because it's in my chart. And I said, yes, but in your chart, it only says twice a day. They didn't know you were taking it 4 times a day either. So keep in mind that higher doses can even be potentially fatal, even with these stimulants. At higher doses, they can have chest pain, they can have elevated blood pressure, they can have inability to sleep when it's their time off and they should be sleeping. They can get muscle spasm. We had one donor who was about to get surgery for muscle spasm in her jaw, and it turned out the Adderall and Vyvanse were over 70 milligrams. And I said, why don't you discuss with the doctor who's prescribing the medicine if you're potentially having muscle spasms because your medicine is too high before you have the surgery. And they were very grateful for that additional information, because a lot of people don't realize what the side effects are of these high doses of these medications. All righty, another case. We have traveling nurses. This is another example, and they have very long shifts. After they do a lot of heavy lifting, their backs are hurting, they get injured, they have combative patients that don't agree and sometimes cause them to have minor injuries that they don't even report. They feel fatigued after they work a long day, so they might be achy all over. And they might find their job very stressful, they might feel anxious, and when they get off duty, they might want to go to sleep right away. They might be taking sleep aids in the benzodiazepine category. And again, benzodiazepines have the potential for addiction and abuse and very easily become addicted to these medications. These are medicines that we typically see in long shift work, such as our traveling nurses. This particular scenario, the nurse's test was positive for codeine and it was positive for a benzodiazepine. They did not have a source for the codeine. The codeine was less than 15,000. We got an additional test, which we're going to talk about later, the 6M, which was negative, and the person had no source, no pain medicine, no cough medicine. They did not know where this was coming from. And while we might want to attribute this to poppy seed ingestion, we can't be sure of that. Keeping in mind that people in the medical field have access to medications that contain morphine and codeine, we have to be aware that they have access to these medicines, and even if they don't have a prescription for it, that potentially might be where it's coming from. They might have also gotten it from a friend or a relative. They might have taken an old medication from home that they forgot about, and codeine is both sedating and can be impairing in the workplace. In combination with the alprazolam, that would be additionally sedating, additional impairment. Although there was a bona fide prescription for the alprazolam, there still is a risk in the workplace. And we've had some of our ER physicians say to us, I wonder, is that why my nurses are sleeping at the desk? Are they taking these medicines and working? And we do see a lot of these medications in the workplace. If we uncover that medication, as we did in this case, was very old, we're also going to send a safety concern letter, because they're no longer under supervision of the prescribing individual. The person who was originally prescribing the medicine only prescribed it for a set period of time. They might have only given them 30 tablets. The person may have only taken 10 to begin with, and now 1, 2, 3, 4 years later, they still have the medication, and they decide to pop a pill while they're on shift because they're feeling anxious or whatever that pill may be. Maybe they have pain, and they decide, I'm going to take one of my old Tylenol 3s or old Tylenol 4s. Medications that are old, we believe that they're no longer under supervision, or they're not being taken as prescribed. Maybe it was originally for back pain and now they have a toothache. These are all indications that there might be a safety concern in the workplace. And keeping in mind, all these medications that are narcotic have the potential to be something that's being abused, and if that's the case, then the individual is at even increased risk in the workplace. All right, we're going to talk about some reasons why the medical review officer might ask you to get additional testing. And with our DOT tests, our panels already have some of these tests included. However, not all testing that we need is included in the panel up front. And if that happens and we cannot make the determination without additional testing, we're going to contact the designated employee representative and request that we get additional testing for certain reasons. And that's usually after we have a particular medication or a particular analyte on the test panel that we need more information about. Keeping in mind under DOT, under federal guidelines, above 15,000 nanograms per milliliter in urine or above 150 nanograms per milliliter in oral fluid, we're not going to be allowing anybody to tell us they don't have a source, and we're not going to consider poppy seed ingestion. Typically, if somebody has ingested a significant amount of poppy seeds that are contaminated with morphine and codeine, and keep in mind, it's not something that's in the poppy seed, it's something that's on the poppy seed that got there during the processing of the poppy seeds. If they are ingesting that, we might see levels above 300. We might, in rare cases, see levels above 2,000. And there were some recent newspaper articles that even mentioned in the military, when they did some studies, they showed levels almost as high as 7,000, but we're never going to see anything even close to 15,000 nanograms per milliliter in urine with poppy seed ingestion. If somebody has a level that's lower than 15,000, and some of our panels go down and test as low as 300 nanograms per milliliter, even though DOT testing only goes down to 2,000, and they're considering increasing that, we're going to be wondering, where is this coming from? And one of the things we have to rule out is whether that's coming from heroin or not. And the way we can rule out if that's coming from heroin or not is by ordering a 6-monoacetyl morphine, which is abbreviated 6-MAM or 6-AM, 6-AM. Typically, you'll hear us say, can we have a 6-AM? And the reason we're requesting that test is if it's positive, then the person is not just using something with morphine or codeine in it, and they're definitely not getting it from poppy seeds, they're getting it from heroin. However, if the 6-MAM is negative, we can't rule out for sure, for 100%, that there was no heroin use. Because we don't have a source, and if the 6-MAM is negative, and the level is below 15,000, it might be from poppy seeds, but it might not be, we're going to issue a safety concern letter. And please keep in mind, especially in the roles where somebody has access to codeine and morphine in the workplace, that it could just be just as likely that they're taking somebody else's medicines or an old medication than eating a poppy seed bagel. We do give them an opportunity while we're speaking to them to disclose where it might be coming from, and we do ask them if they have any cold medicines that are for cough or pain at home, and we do try to find a source, but more often than not, at lower levels, we don't find a source. Okay, when we send the safety concern notification to you and it says that we've checked off it's for the opiate rule, what you can do, if you choose to, and this would be best practice, is to have that person evaluated for signs and symptoms of abuse of medication, specifically opiates. And that used to be called the opiate physical. But you can look for other things besides the opiates. And typically, the physician tasked with checking for that would look for things like pinpoint pupils and track marks. They check between the fingers, they check between the toes. There's lots of ways to hide sites where these things might be injected. The physical exam is optional. Effectiveness has been very variable. The reason we don't say you have to get it is because more often than not, we can't find any evidence of illicit substance use, but when we do, it's important to have that person stand down from the job that you're doing because it is a potential for safety issues in the workplace. Once upon a time, when I was an occupational health physician, I was brought an anesthesiologist who was taking medicines, siphoning them off from the medication that was supposed to be given to the patients and using it themselves. And we did find a pinpoint area where the injections were occurring since the injection was specially determined. So we can sometimes find these things on physical exam. If the employer sends the donor to get the physical exam and the donor refuses, then that test becomes a refusal to test, except in the cases of pre-offer cases. And keep in mind, those are the DOT regulations. Some of the states want you to follow DOT regulations, and some employers also like to not recreate the wheel, and they decide to follow DOT regulations as well. Another type of additional testing that we will be asking about has to do with marijuana. Marijuana is a plant, and it has a lot of compounds in it. And when people consume marijuana in any form, a lot of these compounds can show up on their testing. However, there are synthetic forms of this that are in medications that patients are given bona fide prescriptions that they can fill at a pharmacy, and their test might be positive, and it might be positive just for that medication, causing the test to be positive. One of the common ones in the United States is Marinol or Dronabinol. That's typically used in cancer patients who are losing their appetite and have nausea due to chemotherapy. We also see that in end-stage AIDS patients who have lack of appetite, and we want them to keep their weight up. We're using it as an appetite stimulant. And it's also a medication used in glaucoma. These medications are rarely used. We have lots of other medications. There are some other ones on the market. There are other synthetic forms of marijuana in other countries. It's not never that we see this. It is rare, but when we do see it, one of the things we need to do after we verify the prescription is determine, is this coming just from the prescription, or are they using the prescription to cover up and mask that they also are using marijuana, the natural product? Or are they just using both? Maybe they only wanted to reveal that they have Marinol, but they also have a medical marijuana card, and they're using marijuana, the natural form, for medical purposes. Or they're using both, they're not trying to cover it up, and they just don't want to tell you because it's now a drug test that they're using both. What we do is we ask if we can get the tetrahydrocannabidiol test, THCV for short. And when we have the bona fide prescription and we get this additional test, if additional test comes back as negative, what we have done is we've determined that we have not found any natural product. However, you need to understand that if we tested just persons who were using the natural product, plain marijuana, and we did this test, 50% of the time it's going to come back negative. We haven't ruled out completely that there's no natural product here, and that is why we're issuing a safety letter. If the THCV comes back positive, then we report that test as positive. We contact the donor, and if in their particular case they are supposed to be offered the split sample testing, especially if it's a DOT test, then we're going to advise them that they're entitled to order that test if they want to disagree with their test result. Again, if the test is negative, we haven't ruled out completely that they haven't used the natural product, so we're issuing a safety letter. If it comes back positive, we have found both Marinol, the synthetic product, and marijuana, the natural product. Okay, and the third test that I'm going to talk about today is isomers, and isomers differentiate between medicine and an over-the-counter product and the methamphetamine that is typically crystal meth on the street. If we ask you for isomers, the reason we're asking for the isomers is we have found methamphetamine. Your particular panel doesn't include the isomers, and we need to determine between whether it's a Vicks type inhaler over-the-counter product that has the L methamphetamine in it, or a medication called selegiline, or this is the street drug crystal meth or other forms of it, the D isomer. That's why we're asking for that additional testing, and depending on how that comes back, if it's the D isomer in large amounts, then that indicates that it's most likely illicit use, especially if they don't have a prescription for anything that contains the D isomer. That test will be positive. If it's the L ice, then, and they've admitted that they use the Vicks inhaler type product before their test in the right timing, then their test will be made negative. Depending on what they tell us during that interview, though, we still might need to send a safety concern letter if anything comes up that is concerning. All right, we have a little bit of time left to take some questions.
Thank you, Dr. Steele. One question, Dr. Steele, I know that we get asked often when it comes to safety letters is, does that mean this is a positive drug test result? And correct. Safety letters do not discuss what the result of the drug test is. It's just an additional notification, correct?
Correct. We almost 100% of the time send a safety letter with a negative test result. The only time it's with a positive test result is positive for marijuana, for instance, and they have a medical marijuana card. We don't know if you're employing them in your particular state, in that particular position, but we also had another medicine, oxycodone. That was an issue for their particular job. Potentially, and the safety letter has to do with something else that we found on the test. That's the rare instance where it might be a positive with some other safety concern that we're trying to alert you about.
Okay. Another question that came in was around medical marijuana and when the donor claims CBD use. And the question is about CBD is not regulated. It can cause a test that is positive for marijuana due to the way the chemical is created. Are we seeing issues with CBD across the other clients that we do drug testing for?
Yeah, so a lot of times when the tests are coming up positive for THC, the donor notes that he didn't use any THC. I've only used CBD lotion. I only use CBD oil. I only put it in my hair. I only had the CBD gummies before bed. Unfortunately, because those products are unregulated, nobody's checking to see what's in there. There could be THC in there. The story may or may not be what's really happening. There's a very good online resource that the government put out, the DOT CBD notice in 2020, and that has a lot of detail about why, if you're in the workplace and you have a safety sensitive job, you should be avoiding CBD products because they can make the test positive.
Okay.
It's not the CBD that we're testing for. We're only testing for THC. There's THC in that product if they're using it, and it comes up positive.
Okay. We have one last question, and then we'll wrap up. It's going back to a topic you covered on is about the safety letter. What is the employer's responsibility? Is there something listed in a regulation, in a book that says the employer must do this?
No, just trying to mitigate risk in the workplace. So most employers are not risk takers. They want to mitigate any and all risks. They want to have everything go smoothly. If the letters come, you can have the person examined. You can look at what their position is. You can determine if they can do a different position. You can see if the medication or the medical condition can be ameliorated or made better, made safer. There are options, and it's just to mitigate risk in the workplace.
That's right. Safety letters is all about a risk notification, a potential risk, not a confirmed risk. We recommend that if you are the DER or are on the receiving end of drug test results, that as a company, you have a policy on what do you do when you get a safety letter so that you do have a standardized approach when you get it. Definitely recommend working with your compliance departments, your legal departments to, as a company, have a policy in place how you will handle safety letters. And again, that is something that we can help provide guidance on as well. With that, I know we are at time. We're a minute over. Dr. Steele, thank you for putting the content together today and sharing it with the audience. Thank you, attendees, for spending an hour with us. We hope that if you are currently using Vault Workforce Screening, a Sterling company, as your vendor for drug testing, that you have chosen the experts that will help you with compliance with federal, state, and local laws. If you haven't used Vault Workforce Screening, a Sterling company, yet for your drug testing needs, we hope that this also gives you that confidence that we have the experts that can help you on topics such as safety concern notices. If you have any questions in the coming days, you will get a recording of this, so you can refer to that. Otherwise, email us at compliance@vaulthealth.com. With that, I want to thank everyone for their time today. Thank you, Dr. Steele, and I hope you have a good rest of your day. Goodbye.